Hello everyone, I'm Dr. Howie Chen from Joint Santo International Eye Center. Today's topic is part 1 of ocular examination. We will cover the visual acuity, refraction, and visual field examination in this section. By the end of this section, you should be able to perform a visual acuity test and confrontation test for visual field. Vision is the vital sign of ophthalmology. Any ocular examination must include an assessment of vision, regardless of whether vision disturbance is part of the chip complaint. You may think that our vision is clear everywhere like this picture, but actually our vision is precise only at the small central part. The peripheral part of the visual field is blurred. But when our eye moves, and then the entire view will be clearly visible on the central part of the retina. The central and peripheral vision can be assessed by visual acuity and visual field testing respectively. Visual acuity is defined as the resolving power of the eye to distinguish the minimal separable spacing, usually shown as reciprocal of the minimal angle of resolution. There are different units of visual acuity. Snellen is a fraction in which the numerator is the testing distance and the denominator is the distance at which each letter of this line subtends at 5 minutes of arc. The testing distance can be 6 meters or 20 feet. The decimal unit is the reciprocal of the minimal angle of resolution. It can be calculated simply with the decimal of the Snellen fraction. The normal visual acuity is 20/20 or 6/6 or 1.0. A higher value represents a better vision. Logma is the logarithm of the minimal angle of resolution. Normal logma is 0. In logma, lower scores corresponds to better vision. In clinical practice, we measure visual acuity with a visual chart at 5 or 6 meters distance from the eye. At the height of the inspected eye, natural lighting can be used. If artificial lighting is used, the lighting intensity is 300 to 500 lux. There are different types of visual chart. Snellen visual chart has fewer letters on the top and more letters at the bottom, while ETDRS has 5 letters in each line. The optotype can be letters, Tamarin E or London C. If the largest optotype cannot be recognized at 1 meter, check the counting finger, CF. The examiner put up his or her finger and ask the patient to count the number of the finger and record the furthest distance at which the count is correct. If the patient cannot see and count fingers, the examiner waits his or her hand in front of the patient and record the furthest distance at which hand motion could be detectable. If hand motion is still not visible, the examiner uses a flashlight to test whether the patient has light perception. Light perception should not only be checked in front of the eye, but also at the other 8 directions. The two eyes are examined separately. Routinely check the right eye first and then the left eye. Cover the non-inspected eye with an eye shield during the inspection. It is necessary to overcome accommodations in young individuals who are suspected to have accommodative expansion. especially when it is extropia. Sometimes accommodation direction can be achieved in adults by plus lenses. But otherwise, and always in children, accommodation has to be relaxed by cycloplegic drugs. Visual acuity is measured firstly without glasses. It is uncorrect visual acuity, or with aid of the lenses, corrected visual acuity. Accurate assessment of refraction can be achieved by subjective or objective means, and is best accomplished by a combination of the two methods. Objective refraction means that the measurement of refractive error of an eye without input by the patient. An objective refraction is usually performed using retinoscopy or autorefractor. Subjective refraction relies on the patient's response. The results of objective refraction are used as the starting point, and then the examiner adjusts the lenses until the clear list image is obtained. Is it better with lens 1 or lens 2, and which letters are clear, are frequently asked during the procedure. The power of the lenses that provide the clearest image is the final determination of refraction. The clearest image is the best corrected visual acuity. Visual acuity is usually measured using the chart at 5 to 6 meters, but near vision is also important for many activities in life, such as reading, using cell phone and computers. For near objects producing expansion ray of light, the normal eye can increase the refractive power by accommodation to get it in focus. But with age, the accommodated ability decreases, which is called presbyopia. Examining acuity of near vision and the lens need for correction would benefit the elderly. For peripheral vision, visual field can be simply measured with a confrontation testing. The doctor and the patient is 1 meter apart. The patient's left eye is looking at the doctor's right eye, or the patient's right eye is looking at the doctor's left eye, keeping both eyes at the same level. Covering one eye of the patient, the doctor stretched out his or her hand and moved a finger from the periphery to the center in all the directions. When the patient noticed the appearance of the finger, he or she immediately indicates. If the patient can see the finger at the same time as the doctor, the patient's visual field is roughly normal. It is more accurate to check the visual field with a parametric machine. As the patient's eye fixated on a central target, tester objects, flashes of light are randomly presented at different positions throughout the field. When the target appears, the patient responds with a handheld signaling device. Varying the target's size or brightness permits quantification of visual sensitivity of different areas in the field. The smaller or thinner the target that can be identified, the higher is the sensitivity of that location. Visual field examination can help diagnose certain disorders of the retina, optic nerve, or visual conductive pathway. There are specific forms of visual field defect which are meaningful in diagnosis and follow-up for patients with glaucoma. In summary, visual acuity is the measurement of the central vision. There are several different units of visual acuity. The visual acuity of less than 1.0 should be corrected. The refraction of the eye can be determined using subjective and objective measures. Visual field is the measurement of peripheral vision. It can be measured using confrontation tests or parametry. Thank you for joining us. Here are some references for further reading.